It represents the ability of a CT scanner to produce ionizing radiation. Well, of course, we have another dose index that's provided by the CT scanner. It's DLP. It's simply defined as the product of CT di vol and the scan length. The unit is milligray centimeter. We can estimate the scan length by multiplying the reconstructed slice width times the number of slices. It represents the energy that's transferred to the patient. And of course, because CT di vol doesn't represent a patient dose, neither does DLP. But we can use it to say something about risk. If we give a patient 10 slices of CT radiation and we have a CT di vol of 20 milligray, we're going to have a DLP of 200 milligray centimeter. If I double the number of slices, my CT di vol is still 20 milligray, but my DLP is going to be 400 milligray centimeters. So it does give us a representation of how we change technique and how that might affect the biological risk. So in my previous example, my radiation doses were equal, but the second patient's at a greater risk because of the larger length of body that was scanned. And while DLP is the dose to a standard phantom, that can be used to indicate an increase in dose to the patient as a function of parameter changes. Now, what about the fact that when we're dealing with pediatrics, we're dealing with a large variation in size of patient? How large a variation is that really? Well, if you're working in an adult